Good morning. I want to talk to you this morning about a really serious topic, and I think it's something that our community just can't be proud of. We have so many things to be proud of in this community. We're a healthy community. We're sought out for the level of health of even our aging seniors, and we've been recognized time and again for our beautiful beaches and environment. But here's something that's not so good: our prescription drug abuse. It's a serious problem. We've worked on it. The county commission has worked on it. The sheriff's department had worked on it. All of the health systems and health departments have worked on it. And yet it remains a very serious issue for our community. People want to put a label on it. Oh, it must be drug-seeking addicts. But these are people of all walks of life. These are the babies in our NICU that are born to women who are taking narcotic prescriptions, who don't want anyone to know about it. Yet 50% of the frail infants in our NICU are drug addicted and spend at least 6 to 8 weeks longer in that protected environment to be able to thrive. It's seniors who have been CEOs in their lifetime, but at some point have had a narcotic prescription for maybe a tooth extraction. So it's all walks of life. The leading cause of death in our 16 to 24-year-olds is prescription drug abuse. So it's really a problem that we need to take hold of at all levels of our society and at all levels of leadership. Thank you.
I'm Lori White, Superintendent of Sarasota County Schools. I think we're all aware of the incredible increase of drug addictions in our community that we attribute primarily to addictions to prescription painkillers. We're aware of the economic impact, the social impact, and how it's posed a strain on our social fabric. What is really unknown to us in terms of the total impact is when we see in our neonatal units the incredible increased number of infants born with that addiction. We see this as they struggle to go through withdrawal, but what's somewhat unknown is what is the future for those innocent victims of this. I think as a community, we have to accept our total responsibility for addressing this issue for our community. We have the ability to make a difference in the lives of those children if we work together. But it really involves us working together to join hands to have all the networks of support targeting a population that could have incredible impacts in the future. We know those children are impacted perhaps not only from those biological impacts, but from future environmental impacts and social impacts that occur when you're living within families where there is substance abuse of this nature. We don't know where it's going to cause developmental delays with our children. Are there cognitive function impacts that will be long-lasting so they can't catch up with their peers? The research is clear on low birth weight impacts for future development and impacts in future educational progress. I see children come into our school system every day that lack adequate support to be successful and where there is so much potential. I hope together we can make a difference in some small way for the future of these children and their families.
Hi, I'm Sarasota County Sheriff Tom Knight, and just want to take a minute and talk a little bit about what type of drugs and drug abuse we're seeing here in Sarasota County in 2012 and what we've seen in the past, and some of the things we're doing to work together in the community to correct it. And the most drug of choice now is, of course, prescription drugs, and the prescription drugs of oxycodones, meth, opiate-type products, and Schedule II drugs, predominantly prescriptions of doctor-prescribed drugs, and being used for illegal purposes and not for the proper purposes what doctors are prescribing them for. And so a lot of the overdose deaths we're seeing, the poisons we're seeing, and our crimes are being driven by these drugs. So what do we do about it? And what's the Sheriff's Office do? And what do we do working with other agencies? And it really isn't just a Sheriff's Office law enforcement problem. It's a societal problem. It's a community problem. And so here with the Sheriff's Office, we're not thinking that we are the agency that is responsible or the agency that is going to make any changes. We are working with different organizations and collaborations to make Sarasota County better. And part of that is the medical community, who's very supportive of a lot of the efforts going on, working with the Sheriff's Office and the Department of Health in Sarasota County. And inside our jail facility, I have an addiction recovery pod inside of our jail to help people rehabilitation and then moving them on to other nonprofits or rehabilitation locations. But also in the law enforcement realm, we do have some better ordinances that we have helped crack down on those people who are using them, prescription drugs for illegal purposes, and getting those drugs illegally and brought into the county. We've seen our drug rate here in Sarasota County decline, our supply decline, and our price of our illegal drugs increase, which is good. We are starting to see a little bit of a heroin base back now, which is not good, but it's still better than having prescription drugs. So I think with the collaboration of all the providers, the nonprofits, the medical community, law enforcement, our Board of County Commissioners, is that we're all working together for the right reasons, is to keep prescription drugs where they belong, in the hands of the people who need them, not in the hands of the people who are using them for illegal purposes. And I feel confident that we're moving in the right direction. Sarasota County is a leader with this problem that we're seeing, not just here in the state of Florida, but also nationwide. So we feel really good where we're at. We feel good working with Sarasota Memorial Hospital and all of the medical community in Sarasota County, and we're making large strides and we're making strong progress right now.
I'm Bill Little, Deputy County Administrator for Sarasota County, and I've been asked to talk a little bit about prescription drug misuse in Sarasota County. And a lady came to visit me at the health department when I was the health department director, and she wanted to talk to me about the loss of her son, who had died from a prescription drug overdose. We had a good conversation, told her that I would take a look at the data, try to find out from an epidemiological standpoint, was there in fact a problem in Sarasota County or not. We took a look at it and found that when you compared Sarasota County to other communities in the state, Sarasota County was at the top of the list of having a significant drug problem around prescription drugs. Concurrent with that, the medical examiner, looking at the numbers of people that were dying from prescription drug overdose, found essentially the same thing, that we did in fact have a problem in Sarasota County. We've done some things since that point in time, 3 years ago, to begin to address the issue. Sarasota County's enacted a pain management ordinance that begins to address some of the issues of prescription drug overuse and access to those drugs. We've done some doctor education with educating over 500 physicians in the community to make physicians aware of the extent of the problem. And we've done some other educational activities in the community, making people aware. We're making some progress on the problem, but the problem still exists.
My name is Debbie Harmon. I'm the clinical manager of the NICU and pediatrics at Sarasota Memorial Hospital. I've learned a lot about drug abuse in the last few years. We have seen a steady increase in the number of babies that we're seeing in the NICU being born to moms who are addicted to opiates. In fact, last year we had 91 babies in our NICU that were being monitored, going through what we call neonatal substance abuse. I can keep on talking. You're going to have to tell me when to stop, so you just want me to keep on. Prescribed drugs. It's a huge problem as far as the education that we need to provide to people in the community, because if you ask a patient or any healthcare professional, what drugs are you taking, people will not always answer with the prescription drugs that they have been prescribed within the medical community. So we have a lot of education to do. My suggestion is we need to treat it like we did HIV years ago, that it must be mandated that all pregnant women get tested for drugs, so we can properly get them the treatment and the baby the treatment that they both need. I think, again, as a health community, we have to look at how we're contributing to the problem. And as far as moms who are planning on getting pregnant and are on prescription drugs, they need to communicate that information to any doctor they're seeing so they're aware, and that the physician can educate them on the risks of taking those pain medications. We also must start in the middle school age kids in educating them, because that's where the opiates and they're learning about drugs. So I think we need to start with education at a very early age.
My name is Michael Lepore. I am immediate past Chief of Staff at Sarasota Memorial Hospital, and I'm here today to talk about an epidemic of significant proportions that I've been pretty involved with over the past couple of years. I'm going to tell you some simple statistics as to why this is even something that's important to our community. 300% is the first statistic. That's the amount of increase in prescription drug overdose problems that we have experienced in Sarasota, Manatee, and Charlotte counties as of 2006 to 2009. 1.8 deaths per year. Sounds like a pretty impressive number. That's from illicit drug abuse. That's class 1 drugs that are non-prescribed drugs, such drugs as cocaine, heroin. Those are the amount of deaths in the state of Florida per year that we experience. 8 deaths a day, I said per year, a day. 8 deaths a day is actually the amount of deaths that this state is experiencing from prescription narcotics overdose. The population that is so affected is our teenage population. Emergency room visits are up for detoxification. Almost 70% of the emergency room visits involve people under the age of 20. These are statistics that I was not aware of until I heard them 2 years ago at a talk from our pain specialist. And to tell you I was shocked is just something that I can't even stress enough. I was unfortunately personally affected when one of my closest friends lost his daughter to this problem almost a year ago at age 18. This is somebody I've grown up with since I was a child, and to watch him stand at the back of a hearse loading his 18-year-old daughter into the hearse was just something that I almost couldn't bear. There is no treatment center to help these children in Sarasota County right now. We're having to send them to Lakeland, to other areas of the state in order to get treatment. As a hospital that supports our area and this county and is so important for our young children, our young people of this community, I have been asking if we can try to get involved in developing a treatment center that can really make an impact and help the families and the young children, the teenagers that are so affected by this problem. Our emergency room physicians, who I speak to on a regular basis, tell me that there's not a single week that goes by that they are not seeing teenagers that are coming in, either unfortunately having lost their lives to class 2 prescribed narcotics, the most common one being OxyContin, or are looking for detoxification. And again, we really don't have a program here to help these people. As a physician that's grown up here, I've been here most of my life, and has teenagers, I am really asking and trying the best we can to see if we can't make an impact and develop a treatment center here that can help the young people of this community. Last statistic I'll leave with you is number 2, second highest death rate of teenagers for all counties per capita in the state of Florida. That's Sarasota County. We need to make an impact on this problem, and we need to attack it immediately.
I'm Dr. Washington Hill, and I am a physician here at Sarasota Memorial Hospital dealing with high-risk pregnancy. I've been here for 20 years. I've been asked to make some comments about the problem of substance abuse and our pregnant patients in our community. Certainly over the past 5 to 10 years, we've seen a significant increase in the number of patients who come to see us who are pregnant and have been abusing substances. Most of these substances are street drugs or medications or pills that they've gotten from friends, family, colleagues, whoever. And what this does is it places the pregnant woman not only at increased risk for herself, for example, if she's using cocaine, but more importantly, at increased risk for her unborn child. Babies that are born as a result and fetuses that are exposed to drugs are at increased risk, not only for dying inside the uterus, but also in dying after they are born. They also have what we call the neonatal abstinence syndrome. Well, the question really is, what can we do to prevent this? It's a very complex issue because, as you may or may not know, using drugs is not really against the law. is when you do something where you're under the influence of drugs that is against the law. We need to be educating our children in elementary school, in high school, in college, that the use of drugs can be harmful to them and to their families and to their children. We then need to be educating those unfortunate individuals who are using drugs about the effects of those drugs, not only on their own body, but on the unborn child. We have programs that can do that fairly well, and we do that fairly well in our office. But we need to go back further and educate high schools and children. We need to educate elementary school students about the effects of these drugs so that they will understand them and then not use them. So I hope the programs that we are trying to initiate in this county and in this community and at this hospital will address all those issues. Education of our students, good programs for care for those who need those programs who have been abusing substances and drugs. Thank you very much.